Have you ever seen someone with what we call pink eye? Most persons see the eye, it's red, it's bringing out discharge and stuff like that. That's the classical of bacterial conjunctivitis. There's many other things that can give you pink eye: allergic conjunctivitis, viral conjunctivitis, and a list of others. So bacterial conjunctivitis, as the name implies, of course, is caused by bacteria, streptococcus, staphylococcus, and a host of them. So if you're wondering what's those things doing inside the eye, what it means is that you most likely dust something that is dirty and put your hand inside your eye. Okay, that's why it's ideal we keep our hands clean. So most likely somehow can be also sharing dirty stuffs, could be towels, could be children playing together. And then this one touch and the other one touches and then it gets to go around. So the only way you can know, particularly aside the discharges that come out in bacterial conjunctivitis, is if you actually do have a proper check and then you know the proper way to treat it. So bacterial conjunctivitis caused by bacteria usually comes with these signs. There's usually discharges, usually maybe green discharge and rest of that. You most likely wake up in the morning and your eyelids are gummed together. Okay, there might be a little bit burning sensation, maybe tears, but of course the eye will feel pink or red. But then, unlike allergic conjunctivitis, it doesn't usually come with itching and the rest of them. Okay, so some of these things, it's from your complaints and what your doctor sees, you can be very sure what particularly is causing the conjunctivitis. All right. So, but usually there's usually lots and lots of discharges, and this you wake up and your eyelid is gummed together, and then the rest of the other things that you would feel. Some of you people immediately start seeing discharges from your eye, and if or you have bacterial conjunctivitis, you can call it anything. Some of you call it Apollo, which is not exactly the same thing, but then it can look like that. Okay, what things you do, just run to a pharmacy, carry one, especially chloramphenicol, carry it and then put inside your eye. For bacterial conjunctivitis, it's ideal. Of course, the doctor is going to give you an antibiotic eye drop, most likely an ointment, and then based on your complaints, maybe a few things to make you feel comfortable, maybe lubricant and stuff like that, depending on what your doctor feels. Okay, and then there's also other hygiene practices: keeping your hands clean, making sure you clean the discharge with a disposable stuff. It could be cotton wool, or you just clean it and throw it away. You don't need to use your hanky or your hand and reuse it so that you don't infect the eye. So do not use your hanky, do not use your hand, do not even use your clothes. Okay, use something you can use to clean the discharges and then throw it away, and then avoid putting your hand regularly into your eye. Okay, usually if you have bacterial conjunctivitis, you've noticed there's discharges and stuff like that, and you've gotten your medications. One thing is that usually that's why it's good to have proper medical care, because of course in few days you should maybe usually self-limiting. Self-limiting, that means that your body is able to take care of it. So even as you use your eye drops, you're able to heal faster, and in a couple of days you should be fine. But if you have such kind of things and you're taking medications and in a week or two there's no difference, it gets worse or it's the same, then you actually need to seek proper medical care. There could be other causes, or you're not using your eye drop very well, or you're infecting the eye again, or you're being resistant to the antibiotic you're using. So your doctor might need you to do probably some culture test, and yes, you can be actually resistant to eye drops, antibiotics, because probably you use them a whole lot and your system have gotten used to it and cannot allow it to fight the infection. So you might need to go back to your doctor for a proper review. Okay. I always say you don't know particularly what would be causing your discharge or the redness in your eye. You might not be very certain. So your doctor will hear your complaints and then do some examinations and be sure. You don't just assume, okay, because my eye is feeling this way, I woke up, it's red, so it's maybe bacterial conjunctivitis or what this. It could be as a result of any other thing. Okay, so that's why you need to seek proper medical attention, so that not just the drugs, you also be given the proper counseling to help you manage the situation, and then you'll be fine. Okay, try as much as you can to avoid the random getting of eye drops and putting it into your eye. But then, like I said, bacterial conjunctivitis is caused by bacteria and can easily spread around, right? So just stay tuned and then get to learn more about things in your eye.